More than 200,000 Americans have died from COVID-19. That's more deaths than any other country in the world. Although we account for only about 5% of the world's population, the United States has nearly 21% of deaths as of mid-September. Additionally, the United States is the only major industrial economy to have its unemployment rate triple due to COVID-19. How did we get here? We compiled information from the past 7 months to piece together what happened. It started with President Trump reportedly ignoring intelligence warnings.
President Trump was warned over and over again that his administration wasn't ready for a pandemic. In January 2017, about 2 months after President Trump is elected, the Defense Department puts out this pandemic response report, which notes that the most likely and significant threat is a novel respiratory disease like the coronavirus, and warns of a shortage of ventilators, face masks, and hospital beds.
Fast forward to March 2020, that's exactly what happened.
America is not prepared, and nurses are not being protected.
I am very frustrated and I am very afraid. Not because I am faced with taking care of COVID positive patients, but because I go there unprepared, unprotected.
Felt like I was working in a war zone. So basically I just spent the last 13 hours treating 2 critically ill COVID patients on the vent, basically by myself. And this is my new normal for the next however many months that it takes for this virus to die down. So I'm already breaking. So for sake, people, please take this seriously.
Meanwhile, President Trump actively downplayed the severity of the virus from the time he was briefed of its existence, possibly as early as November 2019, to his most recent insistence that he could not have done more to stop the spread. Let's take a look at just a few highlights of how President Trump handled the coronavirus. On January 7th, Trump privately discussed the threat of the virus with Bob Woodward on a tape that Woodward released in September.
It goes through air, Bob. That's always tougher than the touch. The touch, you don't have to touch things, right? But the air, you just breathe the air, and that's how it's passed. And so that's a very tricky one. That's a very delicate one. It's also more deadly than your strenuous flus.
Publicly, when asked whether he was worried, Trump said,
"No, we're not at all, and we have it totally under control. It's one person coming in from China, and we have it under control. It's going to be just fine."
January 30th, the World Health Organization declared a global health emergency. That night, President Trump held a rally.
President Trump continued to hold rallies, go golfing, and spread misinformation about the coronavirus through January and February.
A lot of people think that goes away in April with the heat, as the heat comes in. Typically, that will go away in April. We're in great shape, though.
Though by March, he was forced to stop holding rallies and going golfing, the misinformation continued.
You treat this like a flu. Because of all we've done, the risk to the American people remains very low.
The Woodward tapes prove he knew that wasn't true.
This is more deadly. This is 5 per, this is 5% versus 1% and less than 1%, so this is deadly stuff.
While Trump knew of the deadliness of the disease, he was saying things like,
"It's going to disappear. One day it's like a miracle. It will disappear."
As we're all painfully aware, the coronavirus did not just disappear. As cases rose, personal protective equipment, hospital bed capacity, and healthcare workers' safety plummeted.
I don't know. I just feel like there's only so much anyone can take. I'm tired of walking into rooms and your patient's dead. You just walk into a room and there's a dead body there. I'm tired of calling families and telling them that news.
In an effort to stop the spread, doctors and celebrities alike took to social media to plead Americans to stay home.
So you've heard about flattening the curve. This is what that curve means. The number of cases of coronavirus, if we don't do anything besides just what we've been doing, if we follow other countries' leads, it's basically exponentially growing. It means it doubles to triples every 2 days or so, roughly. And this is the healthcare system capacity. That's a line. If we don't do anything without protective measures, we're going to end up here, above the ability to take care of everybody. What that means is that all these people, and probably more, die.
I got a message for all you young people out there who think that it's business as usual. It's not.
We need to stop the spread of this virus, and we can only do it together.
Everyone can be a carrier. We got to be smart.
Let's act like we live in a community, not just by ourselves.
As people hoarded toilet paper and wiped out grocery stores, the death toll rose steadily.
I lost another patient to COVID-19 yesterday. When her heart stopped, I broke her ribs and her sternum, trying to help her and save her life, even though I knew in my heart it was futile.
This is truly scary and nobody is taking it seriously. I want to jump through my phone and strangle people that are on the beach or out with their friends still.
Despite insistence from healthcare workers and medical professionals that the coronavirus was a dangerous threat, President Trump continued to mislead Americans.
Because people get better. I mean, most people are getting better. Most, by far, you get better.
He even started pushing the drug hydroxychloroquine, despite medical experts on his own task force saying that there was no proof that the drug was an effective treatment for COVID-19.
If chloroquine or hydroxychloroquine works, or any of the other things that they're looking at that are not quite as far out, but if they work, your numbers are going to come down very rapidly. So we'll see what happens, but there's a real chance that they might work.
Is it possible that your impulse to put a positive spin on things may be giving Americans a false sense of hope?
No, I don't think so. Many doctors, and I've read many doctors, they can't believe the great job that we've done.
It pains me to say this, but it really was an unmitigated disaster, what the Trump administration has done.
There is a direct correlation between the way the Trump administration handles this crisis and how many Americans will die.
Testing in the United States was virtually unavailable nationwide until the summer, despite the World Health Organization offering tests to the White House in February. The Trump administration refused the tests, saying we'd produce our own. Speaking of producing our own medical resources, people were forced to make homemade masks due to a shortage of PPE. But regardless of the shortage, for months there wasn't really a clear message on whether or not we should be wearing masks.
So with the masks, it's going to be really a voluntary thing. You can do it. You don't have to do it. I'm choosing not to do it, but some people may want to do it, and that's okay.
Mr. President, there was a lot of interest about whether you would end up wearing a mask today. Yeah. Could you just take us through your thought process of why you decided not to wear a mask?
I had one on before. I wore one in this back area, but I didn't want to give the press the pleasure of seeing it. And your second question was? I couldn't hear you. Can you take it off because I cannot hear you?
I'll just speak louder, sir.
Oh, okay, good. You want to be politically correct. Go ahead.
Somehow, perhaps because the president used coded language like politically correct, staying at home and wearing a mask became politicized.
There's no pandemic. Media is the cancer.
For heaven's sake, open the barber shops. Open the hair salons. We need haircuts, okay? We gotta buy food. We gotta go to work.
I don't wear a mask for the same reason I don't wear underwear. Things gotta breathe.
And just like that, anti-maskers became a thing.
We will get together and do a citizen's arrest on every single human being that goes against the freedom of choice.
We aren't asking for much. We are asking for compassion. We are asking you to value human lives over your freedom.
Let me feel safe. I have family that I have to come home to, and the way things are looking, this isn't gonna get any better. I'm so scared. I'm so scared. I don't want anybody I love to die, and I don't want to die.
People are gonna die. They die no matter what.
Yes, people die. Death is in fact part of life. But 200,000 deaths in a matter of months is not just collateral damage. Analysis of data from the Institute of Health and Metrics Evaluation suggests that tens of thousands of U.S. deaths could have been prevented if President Trump had issued physical distancing guidelines even 2 weeks earlier, when he had already been warned of the threat for months. The 200,000 dead were real people with real families. And still, people are not taking the pandemic seriously. The pandemic, however, doesn't care if you're tired of it. In July, the US set a new record for daily cases, topping its peak from April.
Today has been one of the worst days by far.
Started about 3 weeks after my state reopened, which was May 15th, when the governor pushed forward with a lot of reopening activities, and many people kind of went back to work, literally, physically, mingling with each other, kind of almost like before, almost like we don't have a pandemic. Unfortunately, we still do.
I had a mom and grandmother drive themselves into my hospital, and only one drove home.
I don't know. I just feel like people think just because we're like a healthcare worker that we are somehow immune to this, and we're not. I cried the whole way home with the Uber tonight, and the driver was like, "Ma'am, are you okay?" I was like, I don't think people understand how stressful this job is. I wouldn't trade it for anything in the world, but it's so stressful. I wish sometimes people could just understand to give us a break.
Here's the thing. We can give healthcare workers a break. By wearing masks, by practicing physical and social distancing, and by staying home when we feel sick. As much as it sucks to hear, please hear this. The pandemic is not over, but we can all do our part to help ensure the health and safety of our fellow Americans.